Welcome back to What Really Matters, listeners. Good to have you with us. Continuing our conversation with Doug Jones, the 20-year veteran from Eden Hospital, member of United Healthcare Workers. Doug, good to have you back with us.
Thank you.
I really wanted to get my arms around, as a California native, if I may say, the AB8 discussion. As I understand, there were a bunch of different competing proposals around California's healthcare initiatives. The governor had one, Don Parada had one, Fabian Nunez had one, and all of that sort of got smushed together from the legislative side, I think, into AB8. And you were saying before we took the break, there were major areas of concern that your coalition had, but that you felt the AB8 was, could I say, a fair and just bill?
Yes, we do feel like in a number of ways that it's going to provide substantial health care reform. There's also, in addition, there was also Sheila Kuehl's bill, SB 840, which was going to create a single-payer health care system, which we also view as an ultimate goal. Under the current circumstance, it wasn't going to be passed, because it would require quite a bit, it would require Republicans in the Assembly and the Senate to vote for it, and that wasn't happening. And the governor had also vowed to veto it again. In the case of Assembly Bill 8, it is possible to pass this year, and did pass, and it creates circumstances like a bulk purchasing pool for pharmaceuticals.
Okay.
So that would lower the rate of medications for Californians substantially, in our view. It also creates a public competitor to private healthcare companies. In other words, not just giving people assistance in buying private insurance, but providing them a public option. And the great thing about a public option to private insurance is that a huge profit motivation would be taken out of the process. So we feel like it's fairly likely that that public option would be able to provide substantially lower rates in many cases.
Nice. I like that.
The bill also creates a circumstance in which private healthcare insurance companies would require to use at least 85% of the premium money that they gain towards actual patient care. What we have
as opposed to overhead. Or...
Right. What we have now is a current circumstance where oftentimes private insurers will have 20, 30% or more of the money that they get from patients, and they'll spend it towards marketing. And in the case of, unfortunately, Blue Cross, they're spending more than $2 million of their patients' money to try to fight this healthcare reform. Full-page advertisements in the newspapers. It's a reprehensible use of money.
It is. I mean, you pay your premium so that you're taken care of when you go to the hospital, and now it's being used to fight against basic healthcare reform, which when you're in the hospital, that's what you're looking for. You want to get better. I think what both sides need to realize is we're all striving towards one common goal, which is a patient that is preventative in nature. You don't have these problems. You don't have to go to the hospital, but when you are there, please get the person better and then get them back on their way. Preventative is better, but in the hospital, for God's sakes, don't rush them out the door. It just causes longer-term problems. If both sides can realize that's the common goal, we might actually make a little progress. So, you mentioned that AB8 has made it out of House and Senate. Obviously, that's only half of the equation, though it needs the governor's signature. Where are we in that?
Right. It seems very unlikely that the governor will sign it. So what we have is a circumstance in which they're currently negotiating about how they'll proceed, whether there'll be an actual bill that's passed out of Sacramento, or whether there'll be some narrow reform passed, and the substantial parts of a healthcare reform package would be put before the voters to vote on. So that would, our concern is that would delay healthcare reform all that much longer, and in the meantime, there are citizens in California that are suffering under the current circumstance, including some of the members of my union. For example, we have home care workers that if the governor had had his way in recent years, home care workers would be making minimum wage. What's happened
for that kind of work?
That's correct. What's happened in each of the last 3 years, that's been his first position in the budget, has been that home care workers should be cut back to minimum wage. In each case, SEIU, United Healthcare Workers, and other concerned citizens have helped fight back against that, so that home care workers have been making more in the realm of approximately $10 an hour. It varies depending on the county. People in that circumstance oftentimes can't even afford health care insurance for themselves, much less their families. So people that are actually giving the care can't receive the care themselves, And that's why we really feel like it's imperative that this reform happen as quickly as possible, but also as effectively as possible. We want to make sure that reform gets a good name, that this reform effort at the end doesn't happen where a year from now citizens go, oh, that big noise about healthcare reform, they passed something, it didn't help me.
Exactly.
We don't want that to happen.
No, we want substantial change, listeners. You don't want just a piecemeal approach or a Band-Aid approach. I would rather nothing get passed, and certainly we all suffer, but that when it is passed, it's done correctly. A piecemeal approach is not going to help, and if anything, I think it will just endanger the process. It is, I've got to say, it is a bit disheartening. I really had high hopes for that session, of hoping that AB8 would pass, but we'll see what comes up in the next few months. Turning our attention to the national level, again, as this interview airs, I recall listeners seeing a very powerful graphic of little kids with petitions in their red wagons walking up to the White House, literally going up to the front gate and saying, hey, can we drop off these petitions? And it caught my eye, and I tried to learn a little bit more about it, but hey, I've got the expert here. So Doug, tell us about the S-CHIP program. Tell us what all the hullabaloo was about. What's going on at the national level?
The reason this is being discussed substantially right now is that it's a program that was started in 1997 by a Republican Congress.
Okay.
It was meant to address the problems that were happening for people in the United States who couldn't even buy health insurance for their children. In comparison to adults, obviously, health care insurance for children is cheaper to administer because children typically don't have as many health care problems.
Makes sense.
But even under that circumstance, families increasingly weren't able to provide insurance for their children. Children were getting sicker because they didn't receive preventative care, getting on long-term conditions like diabetes and such that are obviously, like, it's not just, once again, fiscally unsound, but morally reprehensible. So in 1997 it was created, a 10-year bill which sunsets now at the end of September. And what's happened is that because the program has been substantially effective at what it was meant to do, assist families, 90% of which are working families, to buy health care insurance for their children, the current leadership in the House and the Senate wish to expand the program to help more of the nearly 8 million families, or 8 million children that still aren't effectively helped by the program. Even though it's helped nearly 7 million children, it still is not capturing all the uninsured children or underinsured children in the country. President Bush views that as a expansion of health care that's socialized medicine, and it's purely a rhetorical position. It's something that's even Republican senators and House members are saying, like, some of the statements that President Bush is making about the S-CHIP expansion efforts that are taking place are wrong. That President Bush is wrong about some of the things he's saying about the bill. He's bound to veto the substantial expansion that's trying to take place.
So here we have a program that's working and has proven itself over 10 years. House and Senate both are looking to expand it, and it sounds like we have bipartisan support.
That's
so
correct.
We're across the aisle on this one.
Yes.
And yet we have a president who's basically wanting to veto health care for children.
Right.
Picking on a population that can't even vote.
Right. Yeah, their parents can, however. And we hope that, if President Bush retains this current position of, in California, by the way, the S-CHIP program is expressed under the Healthy Families Program.
Okay.
Each state is allowed to use the money that they get from the federal government to run their own program. It's one of the strengths of the program is that it's meant to be flexibly used within the states to solve the problems that exist in each state. So in California, it's Healthy Families, and it's been, once again, in California, substantially successful at doing what it was intended to do.
I've seen the billboards on it. I mean, certainly it's an effective campaign.
Right.
And we have seen results from it, listeners, and now we have wanting to expand it so that we cover an additional 8 million children, yet that's being denied. Does that make sense? Do you see the fiscal conservatism? And frankly, does social justice fit into that equation? I don't think so.